One common myth that we see in spine pain and back pain patients is like they feel their spine is delicate and it can get injured very easily. I used to work in active ortho earlier with Dr. Gerd Muller. He used to say like spine is almost indestructible. He used to say another important thing like it can take up a load of up to 1 ton. You might have seen a lot of ladies in the villages. They are carrying too many bricks and different sort of weights on their head, but their spine is going weak. Their spine is going fine with that. So the spine is not a delicate structure; it's a very strong structure per se. And don't consider your spine as a weak link in your body. People who are doing exercises in the gym, they are just trying to strengthen it further. But in general also, it is not a weak structure in your body. It's quite a strong structure, carrying the weight of your entire body from your childhood till the time you die. So it's not nowhere a fragile structure. So don't think like that. Another common myth that we observe in back pain patients is like if suppose an individual is there at a very young age, he experienced back pain due to any reason, they have this apprehension that their back pain may get worse with age. And sometimes you see this line in your MRI reports, or your doctor says it to like degenerative changes are there, bones are just overgrowing around one area, those kind of stuff. So age related changes are always there in everybody. At the age of 30, 60% of the change which has to be there in the spine is already there. By the age of 55 to 60, 90% of the change in the spine is already there. So don't consider like if you are getting age, your back pain is going to get worse. It is not a correlated thing. Some people just try to associate their back pain with genetic predisposition. Like my father used to have back pain, I may also have the same kind of pain, I'll also suffer the same. No, there is no genetic predisposition to the back pain. In no study I have seen this kind of stuff like there is a pre-genetic thing that is leading to the primary cause of this pain. Okay. Now, a lot of people are in dilemma whether they need to go for an MRI or a CT scan to get their spine evaluated. For majority of the cases, diagnosis can easily be done with the help of medical history and physical examination. Yes, MRI, CT scans, X-rays, they help us in different cases, but one has to go for these things only with a professional advice, not by on their own. Now there are some people like who go for an MRI or X-ray. They feel like whatever problem my MRI is showing, how it will get corrected. Like the question that I generally get from my patient, the disc which is slipped out, will it get back to the same position? I have a very good answer to this. There are a lot of people, if you will get an MRI for those individuals, they may have more structural problems compared to the people who are having back pains. So most of the time, like structural problems are not reversing, but they don't need to be reversed as well, because it's the problem of function which is compromised that is leading to your pain. So that is why functional treatments and functional assessment is coming in the picture. Some people feel like if my back pain is not diagnosed properly, maybe it is psychological. Psychological stress always has an influence on our body. Like whenever we are more cheerful, more happy, our posture is more straight and erect. Whenever we are depressed or in anxiety, we are slouched like this. So it definitely affects your posture. So that thing also needs to be considered in the treatment by any spine specialist. For spine issues, functional limitations needs to be examined thoroughly in the consultations. If you are getting functional examination done, then you don't need